Here we go. Okay. Today's meeting is the public hearing for the CDBG. Oh, I'm sorry. I also need to reconnect to Facebook Live. One more second, guys. I'm sorry.
She's the one that's. This is projecting what's on the computer.
Okay. Good morning. So today's meeting is the public hearing for the CDBG and ESG funds that the City of Omaha Community Development Division received through the CARES Act. We're also going to be discussing the substantial amendment to the 2019 action plan that partly goes along with this, but has another couple of other things. Before we get started, I want to take a moment to recognize the pain that our community has felt in the wake of the last week. Aside from being civil servants in Omaha, this is our home. And our hearts are with the family of James Scurlock and with our Black neighbors. These funds are intended to address the impacts of COVID-19. And as with many things, COVID-19 has disproportionately impacted our Black and Brown communities. And this isn't because Black and Brown people are more prone to this disease, but it highlights the impacts that have had the underlying disparities that have impacted our Black and Brown communities in income, opportunity, healthcare access, and healthy housing that we've seen in Omaha for over a century. Our hearts are with our community, and we thought that this was important to acknowledge before we moved forward. Okay. The City of Omaha's Community Development Division received $2.8 million in CDBG CV funds, CV for COVID, and $1.4 million in ESG CV funds. These funds went through a process of an RFP in order to determine what needs were presenting themselves, who was already doing work to respond to COVID-19, and then we made our decisions on funding after consulting with some of our partners. So the evaluation process included some of these factors, such as a preference for programs that are already existing, preference for programs that support a larger client base rather than a more targeted client base. A preference for impacting our most for supporting our most impacted communities, for leveraging supporting projects with other funds to leverage, a consideration of how it fit into the mayor's COVID-19 task force. On another slide in a couple, we will have the list of the priorities that the mayor's task force, as well as the Douglas County Health Department, set as priorities for not just these funds, but in general priorities for helping out with COVID. And then a consideration of the quick guide for CDBG and ESG eligible activities to support coronavirus and other infectious disease response. It also, we considered how things fit into our consolidated plan. You know, as I have told you many, many, many times, we have our 7 priority needs and 13 goals. And so we wanted to try and keep things in the lane because we felt like those things often really supported the coronavirus response as they went anyway. So Lisa is going to come and talk about the 2019 Action Plan Substantial Amendment, as well as the projects that we have decided to fund with our CDBG funds. And then I will come back and talk about what we are funding with our ESG funds.
Can we switch seats? Can we switch screens when we switch seats?
Sorry.
Hi, good afternoon. Thank you for joining us today. I'm Lisa Smith, and I just wanted to talk a little bit about the substantial amendment to the 2019 action plan, because all of the grant-funded projects that we're going to be talking about today are part of this substantial amendment to the city's 2019 action plan. The amendment accepts the CDBG CV and ESG CV funding from HUD, and then it allocates those funds to the new projects in the plan. And this proposed amendment goes before a planning board today at 1:30. That will be in the legislative chambers, and I think it's being broadcast online too. The case number for that is C3-19-088, and it has the title Approval of a Substantial Amendment to the 2019 Consolidated Action Plan. Then following the public comment period this week, it will go to City Council on June 23rd for a vote and final approval. And so, I need to switch slides here. And these are the other items that are included in the amendment. There's the cancellation of the Empowerment Network Youth Center Youth Career Development Program. Those funds are going to be reallocated to the redevelopment of Love's Jazz Building, and that will help support the North 24th Street BID. And then the postponement of the rehab of the Urban Indian Health Coalition is going to be postponed until 2021, sorry. And so now I wanted to talk a little bit and get into about the CDBG projects that we're doing. And we received 23 applications for CDBG CV funding. And we want to thank you all for the variety of great applications that got submitted that were addressed to for COVID. They ranged from housing to small business support, food access, public Wi-Fi and connectivity, data collection, and healthcare. And so, as Nicole mentioned, we were relying on not only our objectives to meet through HUD, but also the priorities that were determined by the mayor's COVID-19 task force and Douglas County Health Department. And those included housing, business support, mental and behavioral health, and food security. After all of the applications were submitted, both city staff and Douglas County Health Department identified several gaps in the services that needed to be supported with the funds. And this included a critical need for increased mental health care and food delivery. So with guidance from the health department, the city reached out to some organizations who were well positioned to address those service gaps. And now to tell you more about the projects that were selected. Oh, this is, yeah, that just shows you what. So the largest funding that we applied was to housing, because as you may know, the eviction courts have been allowed to resume. And so this program from Match will help keep people housed and prevent evictions. Match is the metro area continuum of care for the homeless. And this program is in partnership with Legal Aid of Nebraska They're going to provide up to 3 months of rent or mortgage assistance and legal counsel for people who are facing eviction legal actions. And is Randy on here?
I'm going to check.
Okay. Randy McCoy is the executive director of Match, and if he's on here, we'd like for him to talk a little bit about this project. And if not, then Nicole will talk about it.
Here we go.
There, Randy?
Hi, good morning. Thanks for the opportunity to talk about this. Really, this is an expansion of a project that we launched towards the end of March, a significant expansion of it. And basically, like you mentioned, it is the opportunity to provide short-term rent assistance for individuals who have been impacted by COVID, whether members of their household have become sick or have had to isolate or quarantine because of exposure, but also for individuals who may have lost a job or had their hours reduced as part of the initial shutdown. The project by CDBG guidelines would serve individuals at 80% of area median income or below. It would allow us to provide up to 3 months of rent or mortgage assistance for them to help them get through the crisis. It also allows us an opportunity to sort of layer or target our ability to provide assistance to individuals based on their needs. And so for some folks or some households, there might be like 1 month of rental assistance that is all that they need, or mortgage assistance. And for some, it may be this longer term, 3-month kind of program to get through this current crisis and pandemic. The project with legal aid would allow us to expand services in eviction court, helping to either provide information or support or potentially legal representation for individuals who may be facing an eviction, but also give us an opportunity to engage at that early part of the process and keep them housed successfully and keep them out of becoming homeless in the future. So we're very excited about this. The initial program that we've started has served about 400 households since the end of March, and we think over the next year or so, this is just going to continue to be an issue. So if anybody has any questions, I'd be happy to answer them.
Great. Thank you, Randy. We're very excited about this project too. Because it's the first time that we've had something to help protect people from being evicted. And so now I'm going to go on to our next project, which is North End Teleservices. And North End's project is job creation and retention. They have contracts to provide call center services to the Nebraska Department of Labor for COVID-19 unemployment insurance benefits, and with the Nebraska Department of Health and Human Services to provide call center services for Access Nebraska for COVID-19 and Medicaid expansion. And Carmen Tapio is President and CEO of North End Teleservices, and you're on the call here, Carmen. And so if you wouldn't mind saying a few words about your project, please.
Sorry, I can't. Okay.
Thank you very much for the opportunity today. And I just want to start by saying, Nicole, thank you for your heartfelt comments that really perfectly set the tone for today's forum. We are just so appreciative and honored to have been considered for these funds. And we are also very honored and appreciative to be participating in the state's response to COVID-19. We have, as a result of this, been able to hire an additional 79 employees and create 79 new jobs in Northeast Omaha. Over 55% of our people come from the 68110 and immediate zip codes surrounding within a 2-mile radius of our location at 24th and Hamilton. Our use of funds, in order to provide the support it costs money in the midst of all of it to also move people home. So it's not only about the job creation, which we again are just so grateful for, but the ability to do that in a safe way as well. We have a mission of creating jobs and changing lives, and so the funds will also help us with our job retention. We really look to take care of our employees in a holistic way, and so to retain employees, but also job growth. But along with that, in taking care of our employees in a holistic way, we provide skills training and career pathing to all of our people. We have services that we will pick back up when we move back to an on-premise environment that include transportation services for our employees, where we pick people up and take them home. We would like to expand our intern program, or excuse me, our apprenticeship program that's registered with the Department of Labor. And so we have plans for 3 new apprenticeships, as well as to provide training that our employees.
So I think we lost your sound, your audio there. Okay. Carmen? All right. Well, thank you.
We're just gonna have to move
Yeah.
on.
Sorry, we lost the audio. But thank you, Carmen, very much. That's a wonderful project, and we know it's going to help a lot of people, in addition to the folks that you're employing, the folks who can reach the call center services. So our next project is from Nebraska Enterprise Fund, and it's a business support project. They are going to be providing funding to micro and small businesses affected by COVID-19 and that are owned or employ primarily low and moderate income individuals, and that did not receive PPP, Paycheck Protection Program, or EIDL, Economic Injury Disaster Loan COVID Relief. And NEF is coordinating with the Omaha Chamber and will provide technical assistance to help those businesses develop business resumption and sustainability plans and to utilize other recovery resources. Jim Riff, I hope I'm saying your last name correctly. It's Rife, I'm sorry, Jim Rife is the Executive Director of Nebraska Enterprise Fund. And Jim, if you could join us and say a little bit about, here, he's down on the, farther down the list.
I
Sorry.
think
Bear with us just a minute.
I don't know why I keep losing my mouse.
Okay, hi, Jim. If you could say
yeah, you're always nervous until you can get live. I just want to thank the city and all those involved in the opening words. I agree with Carmen. We're very heartfelt, and thank you we appreciate that. The Nebraska Enterprise Fund is a CDFI serving small and micro businesses across the city and state. And we're going to use this funding to really work with micro and small businesses that have been COVID-19 impacted or responding to COVID-19 by providing essential services, and working with them to develop a resumption plan and a succession plan so that they are starting to make sure that they have the planning framework to restart their businesses, and then provide grants up to $10,000 for the individual businesses. You already hit it. We're worried mostly about the businesses that were not able to get PPP and EIDL funding, because we know those are some of the businesses that are probably the most affected, but also in some of the areas like the North and South NRSAs that need the most help. So that's going to be the focus of our efforts: business resumption plan and business grants for some of the businesses that are eligible. Thank you.
Thank you. Okay, and so our next project is with One World community health centers. And this was a project in which they have already been conducting COVID testing in South Omaha. And this funding will provide clinical case management and patient notification staff. The persons who are testing positive for COVID-19 are provided with quarantine assistance, and that includes food and medicine delivery. And so Andrea Skolkin is the CEO of One World Community Health Centers. And Andrea, if you could talk a little bit more about your program, we'd appreciate that.
Thank you. I hope you can hear me. We're never quite sure with technology, but we are very happy to participate in this program. As people may have heard, COVID has hit very big in South Omaha, and we are a significant testing site, and we have a very high positivity rate among our patients. And this resources coming along at a much needed time because there are so many. We are going to hire about 13 people to do case notification of positivity, making sure that patients understand how to isolate, what that means, and it's not just staying home. And then those individuals will also move to a case management team where we monitor their health over a 2-week time period. And even greater from this allocation of funds, we will deliver food to these patients' home. They're not supposed to go out of their house. And so each of our families or individuals will receive a box of food 1 week and a box of food on the next week. And then it also includes a delivery of this food. We are finding not only they need it during the 2-week time period, but we have many, many hungry people. So that is the project, and we're very happy to be a part and serve the medical, dental, behavioral health, and affordable medication needs, particularly in South Omaha, but across the city.
Thank you. Thanks, Andrea.
Thank you.
And our next project is from the Nebraska Urban Indian Health Coalition, and they will be providing behavioral health services for low and moderate income clients affected by COVID-19. The program is open to all low and moderate income persons throughout the city and expands on their existing behavioral health and substance abuse programs. And Donna Polk is the CEO of Nebraska Urban Indian Health Coalition. And Donna, would you please tell us a little bit about your program?
Well, yes, and I am really very excited to be a part of this project, very honored that you all would consider us. We know that at some point during the pandemic, we're going to see a substantial increase in the number of people who need access to mental health services. These are not people who are mentally ill, but people who may be recovering or in the need to recover from addiction problems, or they may be suffering from extreme anxiety, grief, the loss of employment or housing. And so we want to be able to address this service. So we anticipate serving 150 people who have been adversely affected by COVID-19. We will provide telehealth and in-person services, and we will also case manage them in terms of offering them referrals to other needed services. Now, like Andrea mentioned, the services that One World is currently providing, we're currently doing the same thing. We're trying to meet the needs of people who are hungry. We're certainly at this point referring them to One World or Charles Drew for testing, and we anticipate being able to do testing in the very near future ourselves. so again, we want to address behavioral health needs in the community. At every level, people are talking about the impact that the pandemic is going to have on individuals, and we want to be a part of the community that's meeting that need.
Okay, thank you so much, Donna. That is wonderful. And our next project is also, is also related to behavioral health, and that's with the Charles Drew Health Center. Charles Drew Clinic has been conducting COVID testing in North Omaha and at Omaha Housing Authority sites throughout the city. CDBG CV funding will provide additional behavioral health care staffing and supports continued COVID-19 testing through Charles Drew. I'm not sure if Andrew Monson is on the call or someone else from Charles Drew that could talk about. If there's someone else from Charles Drew, or if Kenny? Okay, Kenny McMorris. Yes. Hello?
You all hear me?
Yes.
Can you hear me? Good morning, everyone. I'm Kenny McMorris. I'm the CEO here at Charles Drew. We too are happy to be a part of this opportunity. I think that if anything else, what this virus has done has exposed the health equities in a way that communities that have been marginalized and underserved for decades, into where we're going to have to do better about addressing the social drivers and social determinants of health. The big part of our project is really looking at how are we addressing mental and behavioral health. But we know that there's a lot of misinformation out there, and a lot of individuals are concerned and worried about what is life going to hold for them now and into the future. And so our program will be looking to hire what we call behavioral health advocates. They will serve as lay individuals, help families that are in our priority areas, whether it's with housing, individuals experiencing homelessness, as a second language, access to much needed services as it relates to their families and dealing with the pandemic. We too have been testing, and we're testing both symptomatic and asymptomatic individuals. And as everyone knows, that in order for someone to isolate in many of our communities, it's a challenge. And so we're doing everything we can to keep our families connected, but more importantly, trying to make sure that we give and we instill some level of hope for what the future may hold. And so the funding will help us connect and outreach and do everything we can to continue to trace and support families as it relates to the pandemic. So we are happy to be a part of this opportunity. We'll be working with other community partners as it relates to food insecurity and housing, as well as providing telehealth services to the greater population.
Thank you, Kenny. And thanks for joining us and giving us that background on the work that you're doing. So our next project is from No More Empty Pots. And food security, just like the shortage of behavioral health care in Omaha, is an ongoing problem. And the need for both has only increased due to COVID-19. And so while the food supply has been relatively stable and the food bank is no longer experiencing severe shortages, food delivery remains a critical service for persons in quarantine, people without transportation, and people at high risk who need to socially distance. No More Empty Pots' prepared meal program and meal delivery serves low and moderate income households throughout the city. The project is in partnership with Whispering Roots, INCAP, Temple Simon, and the Intercultural Senior Center, and includes a culinary workforce training component. Nancy Williams is the president and CEO of No More Empty Pots. And Nancy, can you please tell us about your program?
Yes, thank you. And again, to echo what was shared earlier, thank you for the comments in the beginning, and thank you for the opportunity to serve through receiving this funding. The program that we are offering is a combination of several programs that we currently offer. We will end up serving much more than 115 households with this funding. We have a prepared meal program that's one is called Community Harvest, where folks who enroll get 2 meals per person in the household, and they have the option to add on a CSA share, which has 5 to 7 different options for local produce and or a local product from a local artisan. We also have Feeding Our Neighbors, which is our emergency food response. This week, we will have served almost 9,000 people since March 30th. And these funds will help support that initiative. What we're finding is that initially with Feeding Our Neighbors, where each person in the household gets 1 meal, they're plant-based, made by scratch from the chefs and students and volunteers in our commercial kitchens, that many of them need more than 1 meal per person, and they also need food for a longer time than a couple of weeks. So we transition them to Community Harvest, where that is a more intensive commitment and support for them and folks in their household. We are able to focus on food production because we rely on the partnerships of Whispering Roots, INCAP, Intercultural Senior Center, and the Simple Foundation was one of the first groups to participate in Feeding Our Neighbors, to get the food from our food hub to different people in the community. And it is literally all over the community. There are over 15 different zip codes that we deliver to. The workforce component is where folks are going to go through an 8-week training program. And while they're in this hands-on culinary training program, we will also support housing, childcare, and they will earn income as an intern, because we found that income is a huge barrier when they are in class all day. And we want to make sure that they have the opportunity to have the resources to live their best possible existence right now.
Great, thank you. And you know, this is the first time that we have done any projects that address food security. So we're very excited to be able to add this support with the COVID-19 funds. Okay, so now I hope I can get these things. Okay. Our next project is with the Intercultural Senior Center. The Intercultural Senior Center is in partnership with No More Empty Pots, as Nancy talked about, and with the delivered meals, as well as they are delivering food pantry items and other items to older adults throughout the city who are maintaining social distancing due to COVID-19 or who lack transportation. The clients are referred to them from the Eastern Nebraska Office on Aging, United Ways 211, and Douglas County Health Department. And Carolina Padilla is with us today, and Carolina is the Executive Director of the Intercultural Senior Center. If you could share with us some more about your project, please. Carolina?
Yes.
Yes, thank you.
Oh, thank you. So first of all, I would like to appreciate the funding for ISC related to meals. So I just would like to share that Intercultural Senior Center have been serving the elderly of our community, very diverse in attendance, and so the ISC proposed a meal delivery program for older adults who are maintaining social distance in their homes to keep themselves and others safe during the COVID-19 pandemic. Operating in our facility, which is in 5545 Center, ISC social workers, I've been working with the interpreters as necessary to make intakes assessments over the phone to schedule meal deliveries. Also, ISC drivers, what they've been doing is delivering 120 meals a day per week. And so this funding is going to help us to continue the work in partnership with No More Empty Pots, to those meals can be delivered to the doorsteps. With this opportunity, we are expanding our services, not just as a meal program, but also as pantry that goes along every week when we do those deliveries. I would like to say that ISC regular membership is around 125 adults from over 20 countries that speak primary English, Spanish, Korean, Karenni, Burmese, and Nepali. They have participated in our programs. And most of the seniors, I mean, all seniors have to be over 50. But since we launched the emergency food pantry delivery in mid-March, our client base has grown to include 700 older adults. So a lot of those seniors will be part of this meal program on a weekly basis. And we are trying to accommodate every day more and more seniors, and also see how we can bring more meals to the doors. So thanks to the partnership that we have with No More Empty Pots, we'll make this possible to be continually on a week, and that will raise more awareness for the community to see what the needs, where those meals need to go to. As Nancy talked before, we go everywhere in the community where they need us. So for us getting this grant, it's immensely appreciated, because it's going to help us to continue to do our work as long as is needed, since we have to be very careful about opening up again, because elderly tend to be is an age where people are very fragile, and because of chronic conditions, they cannot get out of their homes. And so we're trying to assist them as much as we can.
Okay, thank you very much. And that's a great project. All of these are great projects, and we're really appreciate all of you being on here today and sharing with us about your programs that you're going to be doing to help further address the needs of COVID-19. And so now I'm going to turn it back over to Nicole to talk about the ESG projects that we're funding.
Okay. So if you're familiar with ESG, you may know that ESG stands for Emergency Solutions Grant, and these are funds that go directly to programs that assist our community members experiencing homelessness or who may be near homelessness. These funds are significantly more targeted than CDBG funds are. And so while we still have the same parameters of assisting programs that do the same ESG activities as regular ESG funds, these needed to be targeted towards the response to, prevention of, and preparation for COVID-19. So I was pleased that we received applications for all types of activities for ESG. There are 5 ESG activities. So this is a slide that will show you how we divide up our ESG funds. Our typical ESG funds cover, we do a 60-40 split, where 60% of our ESG funds go towards our emergency shelters and 40% can go to other programs. Because this is usually a pretty small pot of money, we get about $400,000 of ESG every year. We only typically fund emergency shelters, rapid rehousing, and HMIS. HMIS is Homeless Management Information Systems, and it is the coordinated entry system that allows our providers to track who's receiving what services, and make sure that people get connected with all of the services that they're eligible for and that may suit them best. With these funds, We, HUD recommended, and in our discussions with Match and our providers, rapid rehousing became our priority because we want to get people out of shelter and into permanent housing. A lot of communities are putting people who are living in their emergency shelters in hotels and motels, and that's one solution. And there are some other funds that could potentially be available for that. But we wanted to focus on getting people into housing that they aren't going to have to exit back into a shelter when this is calmed down. And we want to get people out of shelters because they are, by definition, typically fairly crowded. You're living in close quarters, and you have a lot of people who have underlying health conditions, who might be older, who are going to be more vulnerable to severe impacts if they were to get COVID-19. And we've had several shelters that have positive cases in the shelters, and I just want to commend all of our shelters for the work that they've done with that. Open Door Mission, Stevens Center, Siena Francis, I believe, had 2 cases of staff that were positive and were asymptomatic, and they're working on testing. But so far, our infection rate in shelters has been extremely low due to the really great work that our shelter staff have been able to implement. So with that said, we're putting 51% of our ESG dollars towards rapid rehousing to get folks out. With rapid rehousing, you can spend 2 years, 24 months providing rental assistance and support services to get people stabilized in that housing situation. The next biggest chunk is 21% to emergency shelter, the 19% to homelessness prevention. 4% will go to street outreach, 4% towards our admin dollars. With the ESG CV, we are able to take out 10% of admin. We're taking 4% instead, and I'll get to that activity in a minute. And then 2% is going to HMIS for those increased reporting costs that people are going to need to cover. So what that looks like, starting at rapid rehousing, is these 3 agencies will receive $707,000 between them. Together is an agency that already does rapid rehousing through both COC funds as well as ESG funds and with private funds. So we're pleased to be able to expand their programming. This is a large expansion of what we can fund for them, and that's great. The Women's Center for Advancement at $210,000 will serve individuals who are fleeing domestic violence. They are new to ESG funding. We're so pleased that we can bring them into the fold of federal funding because we know that people fleeing domestic violence are an underserved community in Omaha. And then finally, Youth Emergency Services. Well, we work with YES on a regular basis, and they're getting CDBG funding for the first time in 2020. They will be receiving $127,500 to do rapid rehousing. Youth Emergency Services, as their name implies, serves youth up to age 26, and this will help those youth who may be in a particularly vulnerable spot this month, or during this time. Who may need to be leaving abusive homes or unaccepting homes, or just things happen. So thank you to these 3 agencies. I don't have plans for anyone to speak, but if you'd like to, give me a hand raise and or leave a comment in the chat, and we can get you. For emergency shelter, we will be funding 3 shelters for a total of $299,000. So with the shelters, some of the things that came up in our discussions were that they have a steep decline in volunteers due to people staying home and social distancing, so they have to make up staff costs. Their donations for operations in general are coming in lower because we're in an economic crisis as well from this. Their food donations are lower, so they need to really be able to provide food and people to prepare the food. And then the big thing that keeps COVID out of our shelters is the cleaning and PPE. So they've already incurred PPE costs. These are reimbursable, and then they're going to need to keep cleaning. So Siena Francis House will receive $220,000, Stevens Center 68, and Catholic Charities $11,000. These are our 3 shelters that we typically fund, and that's about all that I've got for this. All of these ESG CV funds have to be expended by September of 2022. That's most important with the rapid rehousing and the prevention funds because they are 24-month programs. So as long as we get people into those programs by September, they will be good to be in those programs for 2 full years. Homelessness prevention is an activity that we don't typically fund, but we felt that it's super important right now. Homelessness prevention goes along with those CDBG funds that we're using for rental and mortgage assistance. However, these funds have a little bit more restriction on them. They can only assist people up to 50% of the area median income. Usually it's actually lower than that. So that is a waiver that HUD put into place. And these funds, again, are good for 24 months. So if you are a person who is being evicted from your home, you can contact one of these 2 agencies if you meet their criteria to receive some assistance. And that's not just rental assistance, it's also those support services to help people address the issues that may be causing maybe contributing to their housing instability so that they can get stable in their homes and stay where they're at and not become homeless. So Heartland Family Service, who we typically fund for rapid rehousing, has a lot of leveraging funds for their prevention program. We're pleased to be providing them with $220,000. And yes, we'll receive $42,500 for prevention services. Finally, our other activities that were all just kind of one-stop shops. Street outreach, we will be funding Community Alliance. Street outreach, again, is not something we typically fund. We know they're always looking for funding though, and Community Alliance has been leading the way on this in partnership with Heartland Family Service and Together and several other agencies for several years. I know that for street outreach, they are out on the street, meeting our unsheltered homeless where they're at and helping them access services and housing every day. And this work is crucial as we go through. So we will be funding them for $50,000. HMIS, the Institute for Community Alliances, similar name, ICA helps make the distinction. They will have additional administrative reporting and training requirements as we go through the COVID reporting. So we will be funding them for $25,000. And then finally, our admin dollars. We're not hiring any new staff for this program for our ESG increases. So we are not taking any admin dollars for ourselves, but we will contract with Match because they have been purchasing PPE in bulk to supply to all of our providers throughout the city, along with assistance from private philanthropy. So we'll be providing them with $42,500 in order to continue to purchase that PPE and distribute it to all of our providers, shelter, street outreach, whomever needs it. I'm very pleased that we could do that. We are likely to get a second round of ESG funding. HUD, when the CARES Act went through, was given $4 billion, and we were told that they would provide at least up to $2 billion of that with their regular allocation algorithm. So that's what we received this with, but they only allocated $1 billion. So there is $3 billion of ESG yet to be distributed to cities and states. That the algorithm hasn't been announced, those allocations haven't been announced, and we'll see what we get with those, and we'll re-look at where we're at. I have a feeling that we'll probably need to increase our street outreach and our prevention funds at that point, but we'll work with Match and our providers to figure out what our community needs are at that time. So that's all that we have today, unless anyone who is in the room with me would like to add anything. The public comment for these funds is truncated because we want to be able to get it to City Council, which will be June 23rd, and then to get our agreements going as soon as HUD accepts the substantial amendment so that we can get these funds out to the people that need them. If you have comments, the public comment period ends on Friday the 5th at 4:30 in the evening. Please email them to hcdcomments@cityofomaha.org, or you can give us a call. You can also comment here. You can send us a shout through the Facebook page. Just let me know. And if you have any questions, now is the time. If you have a question of one of our attendees, if they're still here, I'm sure that we can get them to come back and answer your question. So I'll give you to the count of 20 and stare at you awkwardly until then. Oh, yes, and the slides are currently available on our website. We are going to get them translated into Spanish, and we're still working on some of our annotations. So it will be updated with annotated slides as soon as we can fix some of our grammar. Anyone got anything for me? Facebook looks quiet. Y'all look quiet. Oh, there's a delay on Facebook. Okay, well. Okay, well, I have stared at you all awkwardly long enough. Thank you all for your hard work and your dedication to our community. It's much appreciated. We'll see you all in the future and hopefully be back to public meetings before too long. We miss your faces.